can anger issues be related to mental disorders?
Absolutely, absolutely. I cannot even begin from where all anger can stem from. I always believe to say that anger is just a mask. Anger is a symptom. Anger is very, it's a very rare that anger itself is going to be a disease. Obviously, you could be hormonally predisposed. You could have a genetic makeup that makes you more rageous than all the other people. But in a lot of situation, anger, I feel, is just a mask. It's just a symptom of an underlying problem. We see people who are unable to express their emotions adequately, or who feel frustrated, who are neurodivergent. These people, have so much anger, and anger is not just one box. Anger can be a symptom of multiple forms of brain disorders, multiple forms of underlying situations, which could again be biological, they could be social, they could be psychological, or the three of them combined. So anger just in one category is not enough. Yes, we can make a diagnosable criteria, we can go to the books, we can say, okay, yes, you have like a major anger related problem, but anger even in the smallest forms, in the smallest phases, also reflects underlying issues. And I think it's very, very important to address it, that because now I've seen people come up and they say that, oh, we've always been angry, it's our personality to be angry, or my father also used to be very angry, my mother also was someone who used to remain angry. And somehow it's made to be felt normal that गुस्सा करना तो चलो normal बात है, सबको ही आता है, इनके घर में तेज गुस्सा ही चलता है. But anger does not only hurt the one who is angry, but anger hurts the environment around us. It might hamper our parents, it might hamper our children, any form of relationship, personal or professional, or our everyday functioning gets hampered by anger. So it's time we start looking at anger as a symptom and not just as a disorder itself. And let's not normalize anger to great extents that it continues let people suffer in silence. Let's not normalize being angry generationally as well.
Very, very good. I agree completely with what you're saying. I'll just add one more thing here, that
Absolutely.
if we look at irritability and anger, essentially the key here is you use the word frustrated or frustration. People who can tolerate frustration are not going to get irritated. People who have a low frustration tolerance level are likely to get irritated. And if your frustration tolerance level is even lower, then that is more likely to lead to anger. And
Yes.
then that brings us to an entity called impulse. Now, let's say you do something which I do not like. I want to shout at you, I want to scream at you. It's an impulse which is coming up within me, but most people would be able to control their impulses. However, there is a certain subset of people who have a problem with impulse control, and they are more likely to manifest that anger as opposed to people who have good impulse control. So I think it's a combination of low frustration tolerance and poor impulse control, which leads to the anger outbursts. So
Absolutely.
if you say, or if the question is, are they a manifestation of an underlying disorder? You say yes, I say yes. So both of us are in consensus there.
Another point I would like to add is that anger is an emotion, and it becomes a disorder when it turns into a behavior. And I think that's a quote I read, I don't know where, but it's always stuck with me. As an emotion, anger is fine. All of us agree, have it. All of us are bound to have it. It's a part of the normal. But the moment it starts taking a toll on our behavior, or it turns into a behavior, let's say, as you rightly said, that if you have an impulse control problem, it will turn into a behavior. It could lead to an action. The emotion could be led to an action, and that's where it does get into the criteria of being a disorder per se.